Shaun Patel. I am a physician at the Miami Skin and Vein Institute in Coral Gables, Florida. Today we're going to do an instruction video on Botox injections for Masseter Hypertrophy. Extremely commonly seen in my practice, associated with bruxism, which is grinding of the teeth, particularly in patients who grind their teeth at night. What happens is similar to when you really exercise your biceps get bigger. When you exercise your masseter muscles by grinding your teeth, the masseters kind of expand out, hypertrophy, and you get squaring of the face, whereas we all know that in the female face, the sign of beauty is an oval-shaped face. We happen to have a volunteer patient here today. Angela has kindly volunteered for this Botox injection. She does suffer from bruxism, and as you can see in her case, she's got quite significant prominence of her masseter muscles. Relax your jaw, bear down, and you can see that the masseters are very hypertrophied in her case, so she's a great candidate for Botox injection of the masseter muscles. I usually start out with 20 units in either masseter and have them come back in 6 weeks and reassess if I need additional Botox into the masseters. What will happen is that squaring of the face will ovalize with the Botox injection into both masseters. We're going to start off by marking the patient and isolating out the masseters. So bite down for me, Angie. Okay, you can feel the anterior border, you can palpate the anterior border of the muscle as well as the posterior border of the muscle. And what I do is I draw a line from the corner of the mouth all the way up to the mid-tragus. And that's the line below which I want to keep all of my injections. Then I mark out the anterior border of the masseter as well as the posterior border, which is just going to be the angle of the mandible. Alright, and we've got the heart of our injection right here. Bite down for me. You can feel the injection right there. The reason we have this border right here is we don't want to get into some of the mid-face musculature, including the zygomaticus major, which is a lip elevator. And the reason I mark out the anterior border is, and we stay within a centimeter outside of the anterior border, is because there's a muscle here called the resurfacing, which is responsible for smiling, a muscle that contributes to smiling, and we want to avoid that muscle as well. So now that we've marked the skin, I'm going to prep the skin with alcohol, and then we'll proceed with the injections. Skin has been prepped, and I'm asking her to bear down, Angie, and so I can feel the muscle. And then it's really not a very targeted muscle. You do want to go relatively deep because there are relatively deep fibers of the masseters, and if you only inject the superficial fibers of the masseter, you'll get some outward bowing of those deeper fibers, giving a somewhat odd look to the angle of the mandible. Alright, so bite down for me. Feel that, and then I'm just going to usually do about 4 injections here. Alright, bite down and relax. Okay, this is the first injection, and we do 20 units on each side, and I usually do a couple of mixed injections here. Almost done. And that's it. That is a Botox injection, actually a Botox injection for Masseter Hypertrophy. And what we did today was we did 20 units into each masseter on this volunteer patient, and the goal being to relax her masseter muscle and change the shape of her face from a squaring to an oval-shaped face. Squaring is the result of Masseter Hypertrophy, oval shape being the sign of beauty. I want to thank Angeli for volunteering for this Botox injection in this video. Actually, she happens to be my sister, so she didn't have much of a choice. I also want to thank all of you for taking the time to watch this video. My name is Dr. Shaun Patel, and I am a physician at the Miami Skin and Vein Institute in Coral Gables, Florida. If you're interested in learning more about Botox or even Botox for Masseter Hypertrophy, feel free to give us a call or stop by our clinic.